Hi, my name is Erin. I'm a nurse here at Covenant Medical Center, and I am just here to briefly go over the LifePak 15 and LifePak 20. First thing we're going to talk about is placement of our patches on our patient. So they do come in a packaging like this. There is adult and children's. The children's are obviously smaller. If you do have a smaller adult, you can place the patch on the front of the chest and the mid of the back. There are instructions on where to place the patches on the package and on the patch itself. So one goes in the upper right, and then one goes down on the lower left abdomen here. You do have 3 leads for your LifePak 15s and LifePak 20s. So you have your right arm, your left arm, and your left leg. And they are all labeled for you as well. The colors, the way I have always been taught to remember it, is white on right, the rhyme, and then smoke, the black lead, over fire. Okay, first thing we're gonna do is do our checks to make sure that they're working appropriately. Nobody wants to connect to our patches or paddles and the LifePak not be functioning. So we should be checking these once every 24 hours. Typically we see the charge nurses do it, but JCO can ask anybody how to do that. So therefore we need everybody to know and understand the process of this. So I'm gonna do these kind of simultaneously. To turn it on, you're just holding down the on button for both. We'll go ahead and do the paddles for each of these first. So one, you have to make sure that your paddle portion is plugged in. With the LifePak 20, you do have to turn in place when you're taking it out. So turning it and then pulling out. It can get a little sticky, a little finicky, so it might take a minute to get it out. With this one, there's a button and you pull. It's almost like sliding it into a plug, and this is connected to your paddles here. So even though these are very similar, there are just a few little differences, but both of these are you're going to click options, and you can use the toggle here to go to user test. Clicking it here, clicking it here. This one is automatically saying user test in progress, and so it's charging your paddles. This one will ask you if there's any sort of monitoring and close the patient record. So if you had a patient that you hadn't printed out your code summary yet, you would not want to do this because you're gonna lose all of your history. So in this case, I'm gonna say, yes, we're closing out the patient record, and there it will say self-test, user test in progress. And just like this one, when it's completed, it will print it out and say user test succeeded. We always tear that off and throw that away. The LifePak 20 takes about 20 to 30 seconds for the user test to do. So while that is going on, you can make sure that everything around your crash cart is clean, everything is within expiration date. You'll hear a little click, and then it will also print out and say user test succeeded. We can just tear that off, throw it away. So now we have completed the tests for both of our paddles. Let's make sure that we can charge them, and you can actually charge and shoot the power down into the machine. And so you just hit charge here. Oh, I'm sorry. This one automatically turns off after a user test. All right, so now we're gonna actually send some power down into the machine. It is okay to shoot that down into the machine. So we're gonna select energy select, and it's already preset to 200 here. you can use your toggle to go down. Let's take it down to 10 joules. And I'm gonna do the same thing over here, taking it down to 10 joules. And there's a charge button on both of these paddles, so I'm gonna charge it up, and then I'm gonna send it down into the machine. And then it will print out that you successfully shocked. All right, so next thing we're gonna check, since we have checked our paddles and we know that they're functioning appropriately, which is a big reason why we do this. We don't want to have to shock a patient and it not work. So again, that is why we are checking them. But we also have to check this cord that plugs into our patches. Okay, so most of these cords come with a connector here. Some of them come with a little block, but the test plug or the block has to be plugged in. And so make sure that it's plugged into itself. With this one, again, I'm just gonna reiterate that you have to turn this to pull it out. So ensure that you have switched from your paddles to your cord here. Same with here, switching from our paddles to our cord, either plugging it into itself here or with the block. And it's the same principle. Options, moving over to user test. Again, the LifePak 20 is gonna ask if you have any history that can be cleared. We'll go ahead and say yes. So now this is going, same thing here, options, user test, and here we go, user test in progress. Now, while this is going, I think it's a great opportunity for you to lift up your paddles and make sure that they're clean. Make sure that there's no blood or gel or anything underneath them. You can clean with bleach. And so when it's completed, it will again send a little paper out that says user test passed, user test succeeded. Tear that off, throw it out. So after it prints out and it says succeeded, you tear it off. If at any point you see these that say failed or user test unsuccessful, the machine needs to be taken off the unit immediately and sent to Biomed to have it